Hello, how's your morning been so far?
It's been good. Adam had a good night last night. He still
Yeah.
thinks that like 5:30 in the morning is morning, so I'm
Yeah.
trying to like get him to sleep a little bit longer. So
Oh my gosh.
we're figuring
How
it out.
old how old is he?
He's almost 4 months now. At
Oh
the end
my
of this month, he'll be 4 months.
gosh. He's
It's gone
so
by so
cute.
fast. Thanks. Yeah, he's not a newborn anymore, so it's been a it's been a really cool experience. Being mom is like there's no preparation. You just figure it out.
Yeah. Is what's his like personality? Like is he really chill? Is he really like I don't know. What's he
You
like?
know, everybody has told me that he's a really chill baby. He's the only baby that I've interacted with this much, honestly. So
Yeah.
it's hard for me to compare, but he goes to anybody. He enjoys anybody holding him, and he's
Oh,
been really good about just playing on his own, like figuring out his hands. Like I think it's been cool to find him discovering his body is really
yeah.
interesting.
Yeah.
But yeah, he's a really chill baby.
Oh, that's so sweet. Oh, I love that. I wish I was in Hawaii so I could hang out with him and
Well,
you.
you will one day, I'm sure.
Yes, yes, for
Yeah.
sure. Well, I'm really excited to talk about how to get back to running after time off or postpartum or post-injury, whatever that looks like for people. But before we do that, can you tell me like who you are and what you do and how that goes?
Okay. Well, I am a doctor of physical therapy. I am orthopedic residency trained, which just means that I had a certain number of hours with each body part during this residency. So anywhere conditions from like TMJ issues or cervicogenic type headache presentations, all the way down to foot conditions and everything in between. So
Right.
um, yeah, so I graduated in 2017. I did my residency in 2018. So it built a really strong foundation for my first year of practice, which
Yeah.
isn't required for a physical therapist to have, but it was such a valuable experience, and I know you have done the same and more.
Yeah.
So, um, and it's been it's so school. That's my education wise
Yeah.
background. I am born and raised in Hawaii,
Nice.
and I moved back home at the end of 2018. And since then, I worked in a traditional clinic, and then I kind of worked on my own practice as a side hustle type of thing. And then
Nice.
I got married, and now we have our first son, Adam, and um, now I'm kind of just full time in my practice right now. And it's been
That's so
a lot of like fun learning experiences, and but it's really defined how I want to take my career really. So
yeah.
um,
Yeah. What do you feel like if you had like a dream client, what do you feel like that would look like?
I feel like she is definitely kind of someone like me, but maybe that is new to exercise, that wants to be stronger and do all the things that she wants to do. So, like for example, she wants to be able to um, run and chase her kid and enjoy being a mom and without the worries of like getting hurt or
Yeah.
um, and be the best mom that she can be. Really set a good example and be a strong woman to care for her child and enjoy all the things that she likes to do. So
Yeah.
um, you mentioned it. It's like running is people's happy place, and it
Yeah.
sucks when you're injured and you're not in your happy place anymore. So pretty much anyone that wants to um, feel stronger with the things that they love to do. And a runner is somebody that I enjoy working with. It
Yeah.
doesn't have to be runners, but in particular, like somebody that wants to stay active and
Yeah.
is kind of had a setback in their life.
Nice. Yeah. I totally agree with you. I love working with runners, especially women runners, because there's so much tasks that they have to take on that traditionally maybe like the guy in the relationship doesn't. So maybe they're home more, or maybe they have like a more flexible schedule, so they can be home more and work a little bit less. So getting out and running is just like a nice, I don't know, time to just get out and like have their own space to
Yeah.
breathe and do that.
Mm-hmm. yeah, I feel like these things that we enjoy, for example, running, it's so much more than running. Like, so for me, um, like we're talking about time off from running, right? So if I had, if I wasn't able to run or weightlift or climb or even do my job as a physical therapist that can be physical at times, if I didn't, if I weren't, if I wasn't able to do those things during pregnancy and after pregnancy, I feel like that would strip away like a huge piece of me. It's
Yeah.
like that's those are the things that identify who I am as a person. So if I was injured and I wasn't able to participate in all those things, it's just um, I just imagined it one day because that was like one of the things that I was kind of scared of.
Yeah.
So it's more than just being able to do those things. It defines who I am as a person, and it's many of my different happy places.
Yeah.
So being able to help women or other people to keep their happy place, and, recover from an injury. That's my
It's
my
huge.
jam.
Yeah. Have you ever had to take like a significant time off of running?
The most significant time was probably just
Yeah.
postpartum. I I thankfully was able to run throughout most of my pregnancy. I ran
Nice.
until week 35.
Oh my gosh. That's amazing.
Yeah, it's. I mean, it didn't look like how and that's the whole thing is lowering the expectation and being able to just do the active running, however that looks like. If it's slower, or even if it's a run walk, it's just the intention of getting out there and being active. But anyway, I digress. My period of time off for running was postpartum. So basically from week 35 all the way till 6 weeks postpartum, and
Yeah.
we'll talk more about why not everyone should go back to running at 6 weeks.
Yeah.
Um, but that was my period of time
Nice.
not running.
Yeah. Yeah, for sure. I am not a mom, so I have never been through that experience. But I think I had two significant periods off of running. In grad school, I had like an Achilles problem. So I didn't run for a while. And then in like spring of 2021, I had like my hip injury started, and I wasn't really able to run consistently for probably about like I don't know, 6 months. 6 months I wasn't really running, and then it took like probably another 6 months to actually be able to run what I wanted to. So there was definitely the humbleness of just being like, oh my gosh, I'm not where I used to be. Which I think leads me into my next question of like if you're working with someone who's like maybe postpartum or they're ready to get back to running post injury, what are some things that you would coach them on for like a good mindset or headspace to start with?
So I would the first place I would start is like obviously I'd understand the reason why they're running. Like if it is just it brings them, you know, a sense of joy to just be out in the open, be outside and be active, and it brings them, their happy place. They feel mentally just at peace and being able to I guess just exert that level of energy and feel like they're sorry.
It's okay.
So I'd understand why they want to run.
Yeah.
Like, are they running to be at their happy place, or are they running to lose weight or feel better about themselves? Like, there's always a certain reason why that someone wants to be running. So
Yeah.
I'd kind of gracefully kind of peel off some layers eventually and understand that about them. And then really like the time off, it's just returning to running is just, I would gradually get them to just have more time on their feet, right?
Yeah.
So running is a lot of it's a plyometric activity, right? So
Yep.
let's just start with walking. If you wanted
Yeah.
to run a 5K to start with, like a couch to 5K type of progression, I would definitely just have them see where they are walking a 5K. How
Yeah.
long does that take you? How does that feel? You know, and if it doesn't feel right, then we would kind of just use that as our baseline. If that was super easy, like, okay, let's go into like a run walk type of progression. And then, so first I just start off with walking the distance that they want to be able to
Yeah.
run.
I like that. Yeah, I like what you said about finding like their motive behind it, because maybe if they, let's say they were previously a runner and they're like, I want to get back to 6 miles because I really want to lose weight, or I really want that like mental reprieve of running 6 miles, then it's a great way to educate them and say, okay, I don't realistically think we're going to get back to 6 miles for, maybe 3 months or something, which is a long time if you were expecting to get back sooner. But then if you say, I know that we can get you that same stimulus in your brain to like give you that mental reprieve with these different activities leading up to that, and you're productively working to that 6 mile mark that you want to get back to. So I love what you said about that.
Yeah, thanks.
Do you have any practical tips that you're like, when they're like, if someone's like maybe postpartum or just been off of running for like a busy season of life, where is a good place for them to start? I know you said, I think your tip was like, just start with what you want to run.
Mm-hmm. So obviously, I'm a physical therapist, and I have a return to run screen that I
Yeah.
like to put runners through.
Yeah.
It There's a lot of things that don't involve running with the screens. You probably do when you were running the screen. I haven't seen it, but it probably
Yeah.
would look something similar. So a great place to start is just to get a screen, that type of evaluation or assessment. If you're
Yeah.
just to identify where your weaknesses lie. So whether it be like single limb stability, like can you balance on one leg?
Yeah.
I like to describe running as a series of single leg
Yeah.
hops. So how controlled each hop is will determine how much stress is going through your limbs, like from your foot to your knee to your hip to your lower back. Um, so a return to run screen is a great way to start to see where your weaknesses are, and then you can build like what your rehab exercises kind of look like, and then that's where I start with my patients. But for people that don't have a return to run screen, I guess you don't, if they are kind of apprehensive about seeing a physical therapist because nothing really feels wrong or anything,
Yeah.
I
Yeah.
would definitely, a good place to start is just doing simple exercises that I'm planning on. Um, I'm working on like 8 exercises every runner should be doing, kind of
Nice.
free content that I
I
want to
love
hand
it.
out eventually. So I learned in a lot of studies that so a good baseline strength to hit for strength training, because every runner should be incorporating some kind of strength training, is being able to squat or do some kind of bilateral movement like a squat or a deadlift
Yeah.
of 1.5 times your body weight. So I know that seems like a lot, but running requires, like with each hop, it's like 1.5 to 3 times your body weight with each
Yeah.
landing. So
Yeah.
are you strong enough to withstand that force? Um, so a strong baseline strength assessment is somewhere
Mm-hmm.
you can start. I would say that, and then just playing around with how single leg stability type of training can feel like a split
Nice.
squat or an elevated split squat, that type of thing. So
Nice.
um, that'd be a good place to start.
Yeah, I love it. I think, yeah, tapping into like a PT, a running specific PT, would be awesome to get the assessment. I actually created something. It's called the Runner's Self Checkup, and it is basically the assessment that I'm sure it's very similar to what you do. It's literally like the basics of single limb our single limb stance, squatting, single leg squatting, so on and so forth. And it just provides you to take yourself through the screen that you and I would do. And then just like literally score yourself and see kind of where you're falling. And then there's corrective exercises that are super simple. You could do them from home. And I totally agree. That's like a great place to start. And then I also think practically, I love what you said about just having like time on your feet with running. If you were previously a runner, or even if you weren't, I think like run walk is a great place to start. I like a good like 2-to-1 ratio of maybe like running for 2 minutes, walking for a minute. If that feels too much, you could go down to 1-to-1. But like starting at a, half mile, 2 miles, I think is a really, really great place to start with that.
Yeah. I usually do like 2-minute walk, 1-minute run, and just stick with that for like a week and just see how your body feels. And then there's that 10% increase in mileage rule. That's pretty common. And I'd say as a as a runner myself, when I was trying to increase my mileage, 10% was really little, because like let's say you were averaging 5 miles a week, like 1 mile, like 1 mile runs like 5 days a week or something small, short. That's like half a mile increase every week, and that seems kind of it seems really minimal. So I would say like if you have your rehab like exercises and your strength training in check, I'd say 10% is kind of on the lower end for a new runner. And so maybe like I kind of capped it as no more than 30% if you're trying to increase your mileage, and as long as like you're not having any symptoms and you're feeling good about it, like there's something to be said about just your subjective feeling about how your body is. Like, are you recovering well? Are you sleeping well? Are you limping in the morning after this increase? So I'd slowly start to increase it, but I'd say the 10% rule seems so, like when I learned about it, it's like, I'm going to only increase by half a mile this week. So, I mean, be realistic, and I would say like if your mileage is really, really low, I'd say no more than 30%. Is a good increase. I think that's about like a mile and a half.
Yeah, I'm actually so with you on that. And I was talking with someone this morning about, I call it running hygiene, which is just like, how much are you resting? Like, how many rest days do you have? What kind of route are you running? Is it super hilly? So on and so forth. So I think practically for my like return to run protocol with a lot of my clients is like run walk up to about like 2 miles. I think after that 2 mile mark, the run walk phase just starts to get a little bit awkward, especially if you were a runner previously. And then from there, just start running those 2 miles consistently. Increase like your volume first. So maybe you're running, instead of doing like 1 day a week, maybe it's 2 days a week, and then I don't know, 3, whatever. And then start to increase that 10% rule. And I totally agree with you that the subjective feedback of like, I used to run 7 miles. So for me to increase like 3 to 5 miles in like a week time span when the 3 miles were feeling really good is not too much for me. And I feel good with doing it.
Yeah. And I forgot what I was going to say, but something new that I've been playing around with was low heart rate training. And I learned about just like easy runs. And I knew about this a long time ago. Easy runs should be the bulk of your mileage for the week. And it was, I listened to a podcast recently, and it totally reminded me, like, I've been running way too hard for too long. And I think that's the main reason why I kind of plateaued pre-pregnancy. I kind of plateaued at like the best pace that I could keep was like an 8:30 to 9 minute, like comfortably. And I could never get faster than that without like burning out. And I didn't get injured or anything, but it just felt so fatiguing to go faster than that for longer than a mile. So right now I'm kind of reminding myself like, okay, let's go for easy runs more frequently. So this last several days I've been implementing that. So easy runs for me, it's like a 10:30 to 11-minute mile pace,
Yeah.
and it's slow to me. But then at the same time, it's it's so easy on my body, and I really feel like I can just keep
Yeah.
going. And I forgot what it's like to feel like, oh, I can just have a conversational type of like talk with my husband while we were running, and I was like, this is kind of nice.
Yeah.
And so now that I feel like that's a really great way to build a base.
Yeah.
So um, and then with low heart rate training, I forgot who came up with this, but basically it's um, 180 minus your age is like the heart rate that you should be keeping for your easy runs.
Yeah.
The guy that I watched this YouTube video I posted in my story earlier, he basically he runs a marathon sub 3 hours throughout his video, like in snippets, and he's talking the whole time. It's crazy. And like he started off, of course, like his his heart rate, like he started it when he was 30 years old. He kept his heart rate at 150 throughout his runs, and at that time it was like 9-minute miles or
Yeah.
so,
Yeah.
which is still really great to be running a long time for 9-minute miles to me.
Yeah.
And then it slowly, his fitness improved to being able to run this sub 3 hour marathon at 6:45 pace at conversation. Like it looked like he didn't, yeah, exert himself that
Yeah.
much. But if you can train your cardiovascular system and your muscular system to just gradually improve your fitness that way, um, that's it, it's I think that's a really effective way to just minimize injury risk
Yeah.
and just go easier on your body.
Yeah.
So
Yeah, I love that. I also recently started implementing that probably like within the past 6 months. And it was so slow when I first started. I was like, this is crazy. But I love it. And I think another thing that's been helpful for me is just mentally, I don't wear my watch anymore when I run. I used to just keep track of all of my mileage and time. And I just was like, I'm so slow. Like I used to be faster and then now I'm not. So I just mentally like don't want to have that conversation with myself. So I just go. And I go based on like I know how much I need to run like based on landmarks to get my mileage in. And then I just go based on like what my rate of perceived exertion is. So like I'm trying to stay like a 2 to maybe a 3 out of 10. 0 being like 1 being the easiest. So that has really helped me. And then that's like also what I prescribe for a lot of my clients who are like trying to get back to running, but just don't have that, like, they just want to go faster or they want to be what they used to be, which just it's not possible for that time.
yeah, I mean, returning to running is a phase of your life, and everyone has to just, I'd say, like, it's easy to say lower your expectations, but it's, you really, like, not wearing a watch when you're running is lowering your expectations. Like, I'm just going to go from here to there, and I'm going to keep this RPE, like you were saying, this perceived exertion. Because having a watch, it, like, for me, it's great to just keep track of, and I think that's kind of kept me at the time, like, really, I was honing in, like, oh shucks, I'm only at a 10-minute mile pace, like, let's speed it up, you know, like, recently, since this low heart rate training experiment that I'm doing, I just have my heart rate show rather than the time or the mileage.
Nice.
So it kind of just keeps me in check. And of course, like, I'm going based off how I'm feeling at that RPE scale. So I'm just seeing if it's like keeping in check with how my heart rate is. But yeah, returning for my patients that are returning to running, I not only start them on a run walk program, but that perceived exertion, like that you're talking about, and just going for a certain distance and just seeing if you can do like 1 minute, a 2-minute walk, 1 minute run, and then like decrease that walk time slowly, but then also just keeping your RP in mind, and then slowly going from there. But yeah, returning to running after pregnancy is a really humbling experience. So because I think I went at it thinking like, oh, I gotta be at least where I was like when I was running at 35 weeks, right? But
Yeah.
it's not. My body is totally different than it was at that period in my life. So, um, being honest, being patient with your body and where it's at, and if if it starts off with just walking at a brisk pace to be um, intense enough, that's okay. That's where your body is at,
Yeah.
and you have to be patient with your body and know that like if I keep at this, I will get better, and that's what our bodies are excellent at, is adapting and um, just making adaptations to get stronger and get better endurance. So this is a phase of your life,
Yeah.
is what I try to remind you,
Yeah.
remind my patients, and that if you are consistent with it and you stick with the program, you will see results. So be patient with the
There we go.
process. That's what I have to remind myself as well.
Yeah. Going
Uh,
low. There we go. Okay, I'm back. Yes, yeah, I love that you said it's just a phase of your life. And really truly, as a runner, if you want to do races and challenge yourself in different ways, you're gonna have to go through this up and down. Like, you should never always be at your peak fitness all the time. So learning how to go through like the kind of the turbulence of not feeling like amazing, 6 minute miles, whatever, all the time is just part of the sport. And I think it's good. It's good for your heart. It's good for your body, to like relearn how to do these things again.
yeah, absolutely.
Um, I think my last question is, what do you feel like is a benefit of going to a PT that maybe is a runner or specializes in runners, if you are a runner that is going through something like this?
I think the biggest plus is that your therapist is going to know exactly what it feels like to be a runner, because you have that camaraderie. They have that experience of being a runner, and the having somebody that does the sport that you do just creates that connection already, and they'll understand what it's like to have some sort of setback and recover from it, because every runner will have at some point in their running career some kind of setback that they had to overcome, right?
Yeah.
So, and your PT that is also a runner, um, they'll have that understanding, which is a great foundation to trust your therapist, first of all, and then the next reason, I guess, um, they have a keen eye on the sport and the activity, the things that your body needs to have as a baseline like foundation for running. So like these return to run screens,
Yeah.
like not your average PT won't have that in their back pocket to be treating or giving you that assessment with. So having somebody specialize in running will just give you that special treatment, but
Yeah.
also they'll they'll equip you with more knowledge than your typical PT, because they see it all the time, and they have their reps in with this presentation. They kind of will be easier to pick up on certain injuries that are common with running.
Yeah.
And yeah.
Yeah. I totally agree. I think that also running PTs that are also runners value not just stopping running
Mm-hmm.
when you have an injury. I have so many. I network with people all the time. I'm talking with runners, and they're like, "I hate PT. Like, my PT told me I have to stop running," and I'm like,
Yeah.
most of the times you don't have to. Like, really, that's a huge push in my practice, is to not make you stop running. And if I do, because you have like a suspected bone stress injury or something that's kind of needs that rest, finding alternatives for you that can like give you that same relief. And also, I don't remember what I was going to say, but yeah, that's my big one.
Yeah. I agree. I totally agree. Having having to stop your sport is like, it's already like a it's hard to stop what you love to do, and obviously, like we talked about, that's someone's happy place. So like, what are they going to do if, you know, there's other things that they could do, but if you can modify how they're running,
Yeah.
and not completely take it away from them, that will have a good balance of like their rehab and their like mental
Yeah.
health, right? Because
Yeah. Yeah.
just totally stripping somebody of their running shoes and telling them to stop, unless they have some sort of serious injury, like a bone stress injury.
Yeah.
But it's a learning experience, and like, how do we not get that again? I had a bone stress injury, and I forgot to mention that was one of my setbacks when I first started running, and I literally couldn't walk. So,
Yeah. Yeah.
um, your
Yeah.
body will tell you when you should stop.
It will tell
Is
you.
it definitely won't feel right. So, if your PT is telling you to stop and it's not that bad, kind of, you know, like, it can be definitely modified. So, um, yeah.
Yeah. Yeah. And then this is what I was gonna say. Also because we're runners, like part of my prescriptive exercises that I do for my clients is literally run coaching. So I literally say, these are your exercises to do for the week, and then this is your mileage, and this is how I want you to do it, and this is how it should feel for the weeks that they're in PT, which really just isn't common in I don't know, the physical therapy world, I think.
Mm-hmm.
Um, well, I think that's all I have, but I do want to know, like, how can we get more of you? So, like, where can we get more of your content? And then if we are on Oahu, how do we work with you?
Okay. So I've been more active on Instagram, so getting people to just view my Instagram page. I've been posting a little bit more about my running experiences for postpartum and my strength training exercises as well. I'm working on like a return to run type of program
Nice.
that I want to share with others. And then my most recent like smaller project is like a free like ebook on like the 8 exercises every runner
Nice.
should be doing. That hopefully will be out in the next couple of
I love
weeks.
it.
And so if you're on Oahu, I'm kind of a hybrid practice. I do mobile, so I go to people's either gyms or homes um, to see them and treat them, or I rent out a space out in Kahala um, called Treehouse. So I'll
Nice.
have a more private space, and there's like a little like yard area that we can do exercises in. So,
Cool.
and yeah, it's
That's amazing.
been a slow like growth of my small practice. So hopefully it'll keep growing.
It will for sure take off. You are a valuable provider on Oahu. So the people are lucky to have you.
Thank you. Thank you.
You are welcome. Well, thanks for coming on, Adrienne. I am excited to just stay connected and see your ebook when it comes out.
Yeah. Thanks for having me, Sarah. It's been a lot of fun sharing our story.
Yes, you are welcome. All right, I will talk to you later. Bye, Adrienne.
Bye, Sarah.
Bye.